Morning, Barbados, good morning. Wake up, wake up, wake up. Morning to you.
Coming up on 11 minutes after the hour of 6 o'clock on a Tuesday morning, another one of those big words in medicine that presents a trouble for my colleague Cassandra, but you know, for the eye, no, I'm just, Acanthosis Nigricans.
Yes,
Yeah, there you
that's
go.
pretty good.
I
That's
got
pretty
it.
good.
Our dermatologist, Dr. Andrew Lord, is with us. What is this condition? Good morning, first of all. What is this condition?
Good morning, Doug, and to the viewers. Acanthosis nigricans, that's two big words, and I know Cassandra misses being able to pronounce those. But acanthosis refers to a thickening of the skin, and nigricans means a darkening. And this is a condition that you see in the folds of the skin, and it usually tells you that there's something going on in the body.
Would it have something to do with heat or perspiration or something like that?
No, even though it's in the folds of the body, it usually occurs in individuals with increased weight. So there are two forms. One is called benign, and the other one's called malignant. And even though that word malignant is scary, it's extremely rare. But in our population, which is a predominantly black population, the benign form predominates and is seen quite often. So usually Acanthosis nigricans really tells you that you have a problem with the insulin regulation in the body, and you have insulin resistance. So it occurs in a lot of individuals who are overweight. And at least the most common form of it occurs in overweight individuals. So you get a darkening and thickening, which is a velvety color change, sometimes with little growths in the neck. You can get it in the armpits. You can also get it in the groins and other areas like that. And I hope we'll have some pictures to show you.
Yeah, we have some pictures, but I'm wondering why you get it in places that you can't see. That tells me that you obviously don't know about it for a while.
Well, that's just the areas that having the hyperinsulinism occurs. Well, this first photograph shows you it on the sides of the face, and this is common in individuals who are overweight. It looks a lot like what we have spoken about sometime before called melasma, but this is a thickening and a darkening that occurs on the sides of the cheeks in individuals with Acanthosis nigricans.
What causes it?
Well, the causes are, there are quite a few causes. The first and most common cause is being overweight, as I mentioned, and having hyperinsulinism. It can also occur with some syndromes in the body. For example, if you have polycystic ovary, this is a photo just showing you it in the neck. It's a thickening. It looks as though there's dirt in the neck. So for a lot of younger people who are going to school, who happen to be overweight, or older people, some individuals believe or suspect that it has something to do with them not washing properly, but it can't be scrubbed off. It's nothing to do with that. And this is a lateral view of the neck again. You notice the lines in the neck, the darkening, the thickening, and you can also get little growths called papillomas, or you can get skin tags as well coming off, and they usually occur in other parts of the body where the skin comes together. But as we were saying, it occurs also with syndromes. Let's say you have polycystic ovary, which is a syndrome where you grow excessive hair, you get overweight, you have problems with your fertility. Also, if you have too much cortisol in the body or too much growth hormone in the body, or let's say your thyroid isn't working properly, all these things can cause you to get bigger. There are also other forms which are quite benign, where you just get it on the palms or on the soles or on the top of the hands. But that can happen in some individuals naturally. And in rare cases, if you have a malignancy or a tumor, it can happen very rapidly, and in that case, it can occur on the lips and elsewhere. But this photo just shows you the armpits. Again, it causes a darkening and thickening, a velvety thickening, and sometimes skin tags in the folds of the skin. So it's quite common in Barbados. If you look at the necks of some individuals, especially if they're overweight, you'll notice that that's there. But in our situation, it has to do with our tendency towards diabetes and also our tendency to put on a lot of weight.
Well, that was my question. What if you're diabetic? You're more susceptible to having this?
Yes, certainly if you're diabetic, and even individuals who are on insulin sometimes can manifest these changes called Acanthosis nigricans.
Does it mimic any other kind of condition, any other kind of skin condition?
No, it doesn't mimic it because the clinical presentation is so specific. It's only in the face that sometimes you would wonder if it's melasma or chloasma. And I think we'd shown something called acanthosis earlier. This is one from the internet, telemedicine.org, and it shows you a darkening of the tops of the fingers, especially of the joints. And that form is called the acral form that just affects the hands and or the feet. So lots of us being more pigmented can show that, and that's a very benign and natural change that can occur in some individuals.
Well, why would this condition be malignant at one time and not at others?
Well, when it was first described, it was described in a malignancy, so that really brought the condition to the fore. But it happens so much in people of color and also in Indians as well that we had to talk about. This just shows you a close-up of the groin, and you can see the thickening there that we talked about earlier. But as I was saying, it occurred a lot. It occurred initially in someone with a malignancy, and a malignancy of the intestines or of the stomach. And in that case, it can be very prolific, it can be very thick, and it can also involve the lips and inside the mouth and the navel and other places that it wouldn't involve, and it occurs very rapidly. So very rarely it can occur in someone who already has the benign form because of the conditions we spoke of earlier, and then they get a malignancy, then it rapidly deteriorates and gets worse. So anytime it comes on rapidly, you should see your doctor and have it checked out. But in our setting, in our population, mostly it will occur in individuals as they get older and as they get bigger. So of course, we do have a problem with being overweight in the country, and this can be a manifestation.
So besides controlling your weight, what else can you do to avoid the onset of this condition?
Well, certainly, if it's genetic and it just so happens that it runs in your family, there isn't a lot you can do other than control the weight. And all the other conditions that we mentioned, it's just about managing the underlying condition. If it's your thyroid, or if you have a problem with your insulin or your diabetes, or if you are producing too much cortisol in the body, and even if you have a malignancy, just taking care of that, having surgery to remove it, all these things can get rid of it. There are also other things we can do to treat it that are just cosmetic. But if you have an underlying cause and you're not treating the underlying cause, then your treatment will be quite long and repetitive.
For example, the outbreak on the face, well, how would you treat something like that?
Well, for the face, we can use some medicines which can exfoliate and also lighten, and we can do that for a period of time to control it. But still, we'll be working on the patient to gradually reduce their weight and also any underlying causes, managing that.
But before we get to treatment in other areas, tell me though, how do you do a self-examination with the underarm and the groin area? What advice would you give to the Morning Barbados viewers at home who may be concerned because they have some kind of skin condition that resembles that?
Yeah. Well, the important thing is that initially your folds, your neck, underarms would look just like everywhere else. But once you notice that it's starting to get darker and remain dark, and it's not because of an irritation or some result of a medicine you're using or an application, then you should start to look at it, especially if you're starting to grow little bumps and little skin tags in the area as well. Then it needs to be checked out. You should go to your doctor. In most cases, it will be due to benign causes, like overweight, and also some metabolic causes and syndromes we mentioned. And in most cases, it's benign. Very rarely is it malignant. In actual fact, in Barbados, I've never seen anyone present with it in association with a malignancy.
But talk about the differentiation, because the places that we're talking about, quite often you shave, and shaving could result in razor bumps and other things like that. So how do you determine that one is a result perhaps of an old razor or dirty razor, or just
Well, usually an irritation would just have some peeling and maybe some discoloration, but it won't be as intense as the discoloration that occurs with Acanthosis Nigricans. Also, it's a velvety thickening, and if you know that material called velvet, it's a very thick material which will have little folds in it because of the way these folds fit with the body. But there's a distinct difference with the pigmentation, the darkening, and the thickening. All the other things that you mentioned wouldn't give you the thickening that Acanthosis Nigricans would.
How long does it take to get rid of?
Well, it depends on how quickly you can lose that weight safely and in a healthy way, and also treat the underlying conditions. Most people that are treated for it, the treatment is over a year long because a lot of stuff has to be done and everything is done gradually. But the important thing is that we don't want to just be treating the manifestation. We want to treat the underlying cause, and once we do that, we'll have some success. Just treating the manifestations will result in a treatment that's very long, repetitive, and also frustrating.
Does itching go along with something
Yes,
like
definitely
this?
itching is a symptom of it. Because of the thickening and also all the little growths that come out, lots of people get itching with it. So that's something you have to control. Also, you can sometimes get infections as well, but it can be easily taken care of by your doctor once you seek medical attention.
Okay. Let us, for the benefit of our viewers, go back over the condition, explain exactly how it manifests itself. So, because you know what happens quite often, we have these discussions, and then we get these calls. I have a little thing on my hand, or I have something on my face. Is that what do I have what the doctor says? And that kind of thing.
Okay, Acanthosis nigricans, it presents in two forms. Predominantly, the most common form is the benign form. It gives you thickening and darkening with little skin growths and skin tags in the folds of the skin, like the neck, also the armpits, the groins predominantly. It is caused by being overweight or having insulin resistance or a tendency towards diabetes. It can also be associated with conditions that are metabolic derangements, like thyroid conditions. Also, polycystic ovary is a very common form of infertility and overweight and growing excessive hair in women. But there are also benign forms, like it runs in your family. Everybody has a certain body type and shape that leads to it. Or you can have a form that just affects the tops of the hands and nothing else. But very rarely you can have a malignancy, and in that case you may be a slim person, or you may have had it before, and all of a sudden it becomes very thick and develops very rapidly. The treatment is to treat the underlying causes, and also while you're doing that, there are some cosmetic things that can be done, including lasers and dermabrasion, and also lightening and peeling medications.
Dr. Ford, I have to ask you this. So because of its association with diabetes, is there the possibility that the treatment or some kind of medication you take having a negative impact on your diabetes?
Yeah, certainly some people that are being treated can manifest it as well. Also, there's some medications that can cause it. Let's say you're on corticosteroids for some reason. You have an autoimmune condition and you're on a steroid like prednisolone. Taking that can give you the condition as though you have extra cortisol in the body, and you can manifest it. And sometimes they're, like say you're on the oral contraceptive pill and you put on lots of weight. So there are medications that can cause it. And certainly as your diabetes is controlled and your weight is controlled, the condition can fluctuate.
Do I hear you suggesting that women have a greater susceptibility to this condition?
Well, it is seen a lot more in women, definitely, but both sexes can be affected.
Interesting discussion indeed. Let me see if I got that name. Acanthosis
Nigricans.
Nigricans. That's what I said.
Yeah.
Dr. Andrew Ford, always good to get word from you on these conditions that impact on us, and we just don't know what they are.
Thank
Certainly
you.
appreciate it.